been doing this for a long time, and I think I first really became interested as a young nurse. So I had recently graduated and was working in hospital, and we had at that time, as it is now, there are always people who are in an acute care hospital who are waiting for admission to a nursing home. And we shared those patients. So along with all the other regular patient load, as nurses, we were always every day caring for at least one and sometimes two people with a fairly advanced dementia, people who were no longer able to live at home. And it was generally considered by nurses to be hard work and uninteresting, but I actually found it very interesting, and I think it was just my curiosity. I wanted to understand better what their experience was. It was very hard for them to tell me, and I wanted to know that better. I would say that my main focus is really trying to understand better what the experience is for people who are living with this disease, and trying to understand it, I say, from their perspective. And I think probably over the last number of years, the focus that the research has largely taken is really addressing the issue of what people are doing in their everyday lives that matters to them. So we talk about meaningful activity, for example, or social relationships that are really important to people, and how is it that they find ways to continue to be engaged in those, and how can we support them to remain involved in meaningful activity and social relationships in a way that we talk about supporting people's personhood or allows them to maintain social citizenship. Well, when I think about what we've learned about what it's like to live with dementia, sometimes I feel like my research just tells us in a way what we perhaps already know. And one of those things is, of course, it's really hard work day to day when you have an illness like Alzheimer's disease. But at the same time, I think what I've learned through my research is that people find very creative ways sometimes to continue to live a life that's meaningful, that brings them pleasure. And so I guess it's partly because I've been asking those questions of what are the activities and the relationships that matter, and they do matter a whole lot. And in fact, I think people have told me that they matter even more now, living with this illness, and that they allow people to maintain, to still feel that they have a sense of purpose in their lives, that they have a sense of belonging in family and in community. And also I've learned a lot about activities and relationships that bring people pleasure and enjoyment. Fun has been a kind of persistent theme in some of my research, which is really gratifying. I've focused in particular, there's been some interesting work that we've done around creative expression by people with dementia, and the importance, of course, of physical activity. We know from other research that physical activity is really beneficial, but kind of turning the tables a little bit and asking people themselves what it means to them in their lives. And the combination of being physically active and doing that with other people has a lot of profound importance for people in their lives, I think. The current project is in fact kind of a next step. A lot of the previous work, my work has mostly focused on people who are living in community, usually with family, but by no means always. Sometimes people are living by themselves. But the previous work really showed the importance of family and friends, and the work that they would do to help support the person and help keep them engaged. But with this next project, what we're doing is stepping back a little bit and looking at how communities are really doing the same thing. And we're currently working with a particular community group that I talk about it as being grassroots, and it really is. It has come from the imagination of community members who looked around and saw a need for a community group for younger people with dementia, that they didn't fit in an adult day program because, you know, they're 55 years old. They're at a different point in their lives. They have different needs, different interests. So it's a community coming together to find ways to support people. So it's not just resting within within the family or within the privacy of the family home, but it's taking a larger picture and looking at what then community groups can do to support social citizenship of people with dementia. And then the other piece of that's quite exciting, my work is mostly, I say it's qualitative, so we don't do numbers, we don't do questionnaires like that, but really sit down with people and talk with them, and maybe observe, watch people in their everyday lives. But with this study, we're looking for ever more innovative ways to allow the group members, to allow people with dementia who are part of these community groups to have a say, to be able to share their experiences of what that group is all about for them. So if we're evaluating a program, for instance, not just hearing from the group leaders or policymakers about what they think the benefit is, but hearing from the group members themselves about why this matters to me. But it can be difficult, right? Because these are people whose disease has often progressed quite far. So it may be very difficult for them, for example, to take part in a conversation. But we're finding other ways to bring in that experience and get input from them, really get feedback directly from them. So it's quite exciting. That whole idea around dementia-friendly communities really has had more traction for a while in the UK, and it still remains a little bit of a novel idea here. And when I talk about communities being able to support people with dementia, I'm not talking about support in that care sense. I'm not talking about groups that care for people, but really about, and it's not just groups either. So, so for one example, the group that I'm involved with right now with this research study, one of the fun activities they do most days, we're in Vancouver, so the weather is good. People go out for a walk. And they're out walking in the city, and we're learning that this is actually very powerful, not just because it's allowing people with dementia who before they had this group were at home alone. It wasn't safe for them to be out, it wasn't comfortable for them to be out on their own. But with this group, they're out in the city, engaging with people on the streets. And those people on the streets, the people in the gelato shop, the people in the hotel lobby, are learning something about what it means to be living with dementia. We have this image in our minds, I think, still about people in long-term care who are toward the end of an illness. And of course, we know that dementia is something we live with this for such a long time. And that there are things we can do just as the guy at the grocery store to help support someone to continue to get their groceries. There are ways that we can, as communities, learn to do that better. And that's certainly where I hope we'll be able to learn much more about how to build that kind of capacity in our communities.